If your labs are normal and you've been running around to doctor visit after doctor visit and you can't find a real reason why you feel bad, I have the explanation for you. You are more than likely stuck into what I've been calling the cortisol loop. That's right. The cortisol loop is this sort of hum, this vibration, this static that repeats over and over again, impacting how you feel. Everything from how you think and focus and concentrate to the energy that you may have to just make it through your day, to your exercise recovery, your sleep quality. And at the end of the day, as that hum gets louder and louder, it eventually crashes and burns other systems of the body. On this episode of the podcast, we want to spend some time talking about cortisol, the cortisol loop, and nervous system regulation, and why it's so important as oftentimes the root cause of so many of your different symptoms. Hi, everyone. It's Dr. Taz. Before we get into today's episode, I just want to pause and say thank you. Your messages, your shares, your stories are the reason we make Whole Plus. Every conversation here is about connecting the science, the intuition, and everyday life together so you can feel more like yourself again. If you haven't already, hit that subscribe or follow button. It helps us reach more people who need this. All right, let's begin. It's so interesting for me, right? Because doing holistic medicine and integrative medicine for all these years, every few years we, find a new trend or new research or some new finding. And through it all, we've stayed consistent with a couple of key themes, one of which is that the gut is the foundation of health, your hormones are critical, and your mental health is connected to many other aspects of your health. But what is becoming explicitly clear the longer I practice and the more I do this is I sit with patients over and over again and I connect the dots on their health along with my team. We are seeing clearly how it's cortisol and the nervous system and the vagal nerve that are actually driving a lot of the different things we're seeing sort of downstream. And this is why a holistic approach to your health matters. Because you can look at the labs and they can all be quote unquote normal, but they are being driven by this hum. So what's normal at the end of the day may not be normal for you. Let's take a second to talk more about cortisol and nervous system regulation. Some stress is good, right? It gets us out of bed in the morning. It makes us achieve big things. It puts us on a path of maybe accomplishing a goal, whether that's, a fitness goal or a food goal or a family goal, you name it. But when that goes beyond just a temporary stressor that the body can acclimate and adapt to, and instead transitions into a chronic stressor where it's always there, that becomes problematic. Physiologically, let's talk about what's happening before you get to a cortisol loop. Essentially, what's happening is we get the stressor, right? Lying in the room, something coming up, a big deadline, something we're scared of, something we're excited about, right? Because stress can be good too. Well, what happens? Cortisol spikes, we get that little burst, we have an adrenaline rush, it's time to go do whatever, we get that power, that energy, but then it should come naturally down again, stabilizing out in a good, healthy place where we can go about the other duties of our day, whether it's eating, watching something fascinating on television, having a great conversation, or even the most important tool of all, sleeping deeply and consistently. So as those stressors happen, right, good ones, bad ones, they accumulate almost like a set of books on a shelf or in a library, and they start to build. And hopefully, if you've got a great regulatory system in place where you know how to manage your food and manage your stress, and you have sort of the right lifestyle regimens in place, well, all those temporary stressors stay exactly there. They're temporary, what we in the medical community call acute stress. But 9 times out of 10, the patients I see, and even within our own families and our friend community, it's not temporary stress, right? It's chronic. It keeps aggravating. It keeps building. And we don't put the recovery time into it for the nervous system to feel safe again. And this is where the wheels come off. And this is the cortisol loop that we've got to break. But again, let's stay in the science and the physiology of it for just a second. Okay, so temporary stressors, cortisol's up, cortisol's back down. Chronic stressor, cortisol stays elevated. And here's what happens when you have chronic elevation of cortisol. First, you don't feel good, right? And remember, feelings are data and emotions matter. But that high cortisol is impacting that area of the brain that is involved in how we think and feel, right? The hypothalamus, the pituitary, right? All of that is interconnected together. And remember that hypothalamus and the pituitary is directing two specific pathways in your body. All your nervous system hormones, right? And neurotransmitters, serotonin, dopamine, GABA, all of those are being instructed by this hypothalamic pituitary axis. And it's being influenced by cortisol. On the other hand, the influence from your pituitary is on your hormones, right? All the sex hormones, whether it's estrogen, testosterone, progesterone, your thyroid, insulin. And those very much play a role into everything from energy to brain health, fertility, how we transition through andropause, perimenopause, menopause, and so much more. So this hormone cortisol, temporary stressor, great, up, down, resolved. We don't have an issue. We're not in a cortisol loop. When we are chronically experiencing elevated cortisol, hypercortisolism is what they call it, then that in turn is impacting these other two critical components of our health. But here's the next step in that whole pathway. After that cortisol stays elevated for too long of a period of time, guess what happens next? It crashes. So we go from high cortisol, and after a certain amount of time, when we stay in the cortisol loop for too long, we go into a low cortisol state. And when we go into a low cortisol state, then again, we are trying to do things to get that energy back, right? To feel safe again. So that's where we may reach for sugar or carbohydrates or fatty foods, or we may binge drink, right? Alcohol, drugs, all the darkness that's out there. Or we may simply self-destruct because we don't have the capacity to do what it takes to get out of this loop. So we go from high cortisol to low cortisol, and all of that is happening over the span of time. It's not something that happens in a day or a month or even a year. It's usually years that are piling on each other, one after another, until a decade passes, maybe two. And then the next step in this loop is chronic disease. So much so that scientists today are recognizing over and over again how disease is really rooted in this cortisol loop. And the sooner and the earlier we can sink our teeth into it, the more we can turn all of this around. And so I want to make sure you have this visual. I literally want you to see a loop in your mind, in your mind's eye, and see sort of this spinning from an acute stressor, right? Something good, something bad. That cortisol is going up, it comes back down. But that acute stressor now becoming a chronic stress response. We even have a name for it. Actually, we have a diagnosis for it. Chronic inflammatory response syndrome, or CIRS. We see that all the time in clinic. And as that cortisol is now elevated, right, it's eating everything up. It's impacting the gut. It's eating up your nutrients. It eats up magnesium, your B vitamins, your vitamin D, your omega-3 fats, your protein. It wants more and more and more. It's insatiable. And when it can't be fed, it starts crashing every other system. Your hormones, your neurotransmitters, your gut health, your brain health, and so much more. And then you become low cortisol. And then, since there are no more reserves to take, right, the monster's stolen everything, you start to develop disease. All right, let's look at the science behind this for just a second, because there's so much, and I don't want to bore you with a ton of it, but I think it's relevant and it's important, especially when we're talking about evidence-based holistic medicine. This is an article or journal from Cells in 2023 published, and it talks about some of the neurological diseases that we see in practice today and we have worked with so many patients on. Moreover, here's a direct quote, chronic stress is closely linked to the progression of neurodegenerative diseases like Alzheimer's and Parkinson's, driven by excessive cortisol production and HPA axis dysregulation, HPA, hypothalamic pituitary axis, along with neuroinflammation in the central nervous system. We've been talking about neuroinflammation for a really long time in our practices at Whole Plus. But here we've got the research finally saying and showing what we've been seeing in the exam room. The relationship, furthermore, still quoting, the relationship between cortisol dysregulation and major depressive disorder is complex, characterized by HPA axis hyperactivity and chronic inflammation. Lastly, chronic pain is associated with abnormal cortisol patterns that heighten pain sensitivity and susceptibility. Understanding these multifaceted mechanisms and their effects is essential, and they offer insights into interventions to really help sort of allay or mitigate the role of chronic stress and cortisol dysregulation in these conditions. Do you guys know how many patients we've seen with Alzheimer's and Parkinson's and diseases like ALS that essentially were triggered by a cortisol response? This is a pattern that we've seen over and over again. And while treatments today focus often on the disease process itself, they don't connect it back to the cortisol loop. We have got to be thinking about the cortisol loop when it comes to chronic disease. There's also a really interesting differentiation between men and women when it comes to cortisol. In fact, they describe this as not so much about high cortisol and low cortisol, but more about cortisol hyperresponsiveness, meaning men and women have different cortisol hyperresponsive states. In one particular study, we talk about this is actually from the journal Stress, published in 2020. Women have smaller cortisol responses to psychological stressors than men do, and women actually taking hormonal contraceptives have smaller responses than women that are not on any sort of oral contraceptive. Cortisol secretion undergoes substantial daily variation. Remember, cortisol is elevated in the morning, has lower levels in the afternoon, and these differences are accompanied by our response to stress. So just think about women, for example, right? If cortisol is on a up and down, right? High in the morning, low as you go throughout the day, which it's supposed to, and it's supposed to bottom out at night so we get a good night's sleep. So you add that cortisol variation into our hormonal variation, right, where we have cycles of estrogen and progesterone, into a circadian rhythm, right? So now we have all these different rhythms adding up as a part of this cortisol loop, talking to and influencing one another. Women are in a different position when it comes to cortisol hyperresponsiveness. For example, when our estrogen is in a good place, we may have better cortisol hyperresponsiveness rather than when our estrogen is depleted or progesterone is depleted, for example, then we may have more issues there. Women on HRT experience a similar phenomenon. Their stress bandwidth changes depending on what's happening with their hormone replacement therapy. And women undergoing IVF or IUI or any of these treatments will experience the same shifts. So when it comes to women, part of the cortisol loop is their hormone ecosystem and hormone balance and how it plays into this overall equation. But we can't take men out from it completely because men are protected with testosterone levels as long as that testosterone stays in the right zone, right? We've done lots of talks on hormones before, lots of episodes on hormones, on this podcast and outside of it. But again, everything has to be in a sweet spot. So when men are in that sweet spot of testosterone, their cortisol is manageable. But the minute they fall too low or the minute they fall too high, they enter the cortisol loop in a very different way, and their bandwidth goes down as well. So all of us are dealing with the cortisol loop, even our children today, because children today no longer just have temporary stressors. They have chronic stressors from food quality, from the environment, from blue light, and from so many different things they're getting exposed to day in and day out. So this is a universal conversation. So children are now entering this cortisol loop even faster or earlier than what we entered in the past. And it's the reason why everyone's like, why the infertility? Why the cancer at an early age? Why the obesity? This is the reason why everyone is entering this cortisol loop earlier and earlier and earlier, shifting disease manifestation downward. What we used to see at 40, we now see at 30. What we used to see at 50, we now see at 40, and so on. So this is why I used to say for so long that the gut is the root of your health, and I still believe that. But I feel like we can't talk about anything now without talking about this in particular. So let's break down what we can actually do about this particular phenomenon. So if we are trying to break this cycle, right, if we're trying to disrupt it 100%, there are a couple of things we need to be aware of that are sort of subheadings when we think about the cortisol loop. And those include understanding where your gut health is, where your hormone health is, and where your brain health is. And we want to tie it to some of the most common symptoms that we see over and over that are indications that you're in a cortisol loop. So let's start with you first. If you are experiencing fatigue of any kind, right? You're tired, or what was easy to do is now taking a heroic effort. Number one sign that you're in some kind of cortisol loop. A second one is you cannot think, you cannot focus, you cannot process information the way you once were able to. You have some level of brain fog or ADD or ADHD. You might be, you guessed it, in a cortisol loop. If you are starting to see belly fat or belly fat is coming and going, you're in a cortisol loop because that chronic stress response is signaling your liver and your insulin to store fat. You're in a cortisol loop. All the different hormonal symptoms, early PMS, perimenopause, menopause, having trouble getting pregnant. Again, these are all signs that you may be swimming in this cortisol loop. And last, but certainly not least, are all the diseases of inflammation, right? The skin flares, the autoimmune flares, joint pain, muscle weakness. You might be in a cortisol loop. So many symptoms that we see day in and day out in practice are tied back to this physiology around cortisol, how it started out high, how it dropped down to being low, how there's more cortisol hyperresponsiveness, and how people simply cannot find their way out of it. So if you're nodding your head as you're listening or watching, this particular episode, and you're like, oh my God, that's me and that's me too, and you're not really sure where to go or what to do about it, this is the part of the podcast where we're going to try to really kind of help you track, first of all, and secondly, maybe walk away with 3 or 4 things that you can sink your teeth into to pull yourself out of this. Okay. So again, I talked about the symptoms that may match you being in a cortisol loop. They're actually trackers if you needed more data that could help you as well. And I think I've talked about this before, but for example, looking at your blood sugar and the stability of your blood sugar is one way. If your blood sugar is very unstable, if it's going up and down and all over the place, again, that's a sign of cortisol dysfunction. If your HRV or your heart rate variability is low, if it's below about 40, you may have cortisol dysfunction, and that's something to look into as a root cause of any of the symptoms that you might be experiencing. If you've got the 3 a.m. wake up, that's another one. And you can tie that now to the quality of your sleep. So if you're not getting 90 minutes of deep sleep and 90 minutes of REM sleep, again, you may be in a cortisol loop. So this is tactical stuff, whether it's from symptoms or trackers that you can start to look at to arrive at this conclusion on your own before you even enter maybe one of our clinics or anywhere where we are testing cortisol along with the other markers of the immune system, inflammation, hormones, and so much more. And remember, if you are looking at lab values for cortisol, you want to look at morning values, ideally saliva or first morning blood values that are going to help you to understand kind of what your body is doing with this. And oftentimes we'll pair that cortisol value with the DHEA or DHEAS, which is another adrenal marker that helps us to understand what's happening with cortisol. So there's so many different ways to track. But when we go back to the fact that so many people are already here, even our children, even our elders, and everybody in between, and we really need a targeted way to help unwind this, then we've got to think about the body in a holistic way using that sort of 5-body analogy that I talk about over and over again, where you have a physical body, an emotional body, a mental body, right? A sort of community body and a spiritual or energetic body. And while that might sound woo-woo to many of you, right? We know today we've got the research showing how our emotions and our physicality are interconnected, how energetically emotions live in a certain place in the body, and how all of that works together to determine if we're going to stop the hum or the static when you have a cortisol loop, or if we're going to allow it to perpetuate to a sound and an amplification where it takes over the whole body, right? So these are the things to be thinking about when we want you to have an understanding of how cortisol is impacting your overall health and ultimately leading to chronic disease. So let's start with maybe some things you can do, right? Because we want to be hopeful and optimistic, not just all gloom and doom. So I'm going to narrow it down to probably 3 key areas that will help cortisol kind of find its healthy place and at the same time help you to re-regulate your nervous system. Because nervous system regulation is all about teaching the body, all 5 bodies, that it's safe, that there's a space for quiet and for healing. And if the nervous system doesn't get that, cortisol will never get back to that stable level where it's high in the morning and then gently falls as the day progresses. So let's talk about this for a second, because the nervous system and nervous system regulation is related to cortisol and to your vagus nerve, which in turn communicates with the organ that I keep coming back to, which is the gut. So there's a gut vagal response that's very critical in helping your body regulate safety and regulate its response to cortisol. So really reestablishing that gut vagal safety or that vagal tone is looking more deeply at the digestive process and making sure you're still feeding it with foods that help you function, right? So consistent blood sugar foods that are low in refined sugar, processed foods. You guys have heard this stuff before. You're probably rolling your eyes right now. But here's what I want you to take away if you are stuck in a cortisol loop. We have to have consistency of eating because eating is rhythmic. And anytime we take a rhythm away, we influence cortisol's ability to disrupt our health. So eat consistently if there's nothing else that you can do. Eat roughly every 4 hours, keeping about a 12-hour fast. That allows blood sugar to reestablish stability. Secondly, when it comes to the gut and thinking about gut health overall, make sure you're choosing more foods that are clean and whole versus foods that are packaged or processed. Bottom line, it helps the microbiome, it helps gut bacteria, it helps you to get the nutrients you need. And next, when you're in this cortisol loop, things like gut motility or how well the body can move food through the gut gets impacted. So use digestive enzymes to help you break those foods down a little bit more effectively. And if you can get quiet and really narrow down that the gut is really where you're having the most issues when it comes to the cortisol equation, well, let's support it more. Right? This is where we've started adding in things like peptides, like BPC or PDA or KPV to support the gut. We add in amino acids like glutamine, for example, to support a healthy gut lining. And sometimes you do need some supportive probiotics as well to really help seal up those gut junctions so that the body can start getting the nutrients it needs. And I would pair all of that gut strategy with the nutrient strategy to rebuild the body so cortisol can quiet down. And that's going to be your B vitamins, your magnesium, and your healthy fats, and again, amino acids, and trying to get those through food for sure. But also, those are the core supplements that your body might need. A good B vitamin or a B multi, as I call it, a magnesium, ideally a magnesium chelate or a glycinate, and last but not least, an omega-3 that's going to help support the body along with, increased consumption of fats like MCT fats and olive oil. All of those are going to help you in a cortisol equation. No long fasting, no crazy diets, no restrictive eating. All of that just makes the cortisol loop worse. So this gut diet cellular component is something that we all can do, and you can do no matter where you are, and you can implement for your children as well, or even for your seniors or your partners. So that's probably like ground zero, right? Or starting point, whatever we want to call it, home base for really dealing with the cortisol loop and then adding the nutrients into support. The next place I would go is really thinking through how you can re-regulate that vagus nerve or your vagal tone. And this is where lifestyle matters, guys, and looking at how we lay our lives out, right? I run what some people say when they follow me, an exhausting lifestyle, right? They're always like, I don't know how you do it. I don't know how you're in one city versus another city and doing all these different things. But guys, I am deliberate and I am insistent on protecting my energy when I am not doing these things. I checked out just this last Saturday for probably 4 hours. I was not available to my family or to anybody else because I needed to recover from the stress I had experienced that week. So what did that look like for me? Just to give a personal story, well, it looked like going and getting a massage, getting a facial, doing acupuncture, going in my sauna, right? All of these things that forced my nervous system to calm down. And the daily practices matter too. This is where micro habits make a macro difference. The 10 minutes of meditation in the morning or night, the 10 minutes of movement throughout the day, the 10 minutes of just thinking about your food and planning it, all add up to a lifetime of healthy habits. But most importantly, in this context, over time, because everything accumulates over time, it breaks the cortisol loop and it starts to make you feel alive again. And moving on from building a lifestyle, right? And when we build that lifestyle, I want you to apply that 5-body approach to it again, right? So it's not just about the chemistry, which we keep coming back to over and over again. And it's not just about how you structure your day, which is all very important, but it's even about some of the things that you might not be paying attention to. Does your home have a high cortisol rhythm or too much cortisol hyperresponsiveness? Are there peaceful areas or quiet areas? Are you in an environment where you can relax? Are your relationships cortisol balancing or cortisol provoking? Those are all questions to ask yourself if you really want to be on a healing journey, right? Because breaking the loop or breaking the cortisol cycle is not something that's going to happen with one supplement or one medication or one hormone or one thing to do. It's going to be that consistency of healthy habits that address all the dimensions of your health. So if we start to break this down and want to treat the body and the nervous system and help it understand it's okay, it's safe, the fires are not there, they're out, and really retrain it, then we have to be very deliberate about where we start and end when it comes to this cortisol equation. I think you start with the gut, but you build a healthy lifestyle. I think you evaluate everything around you. What is fulfilling and good stress, and what is chronic stress that probably needs to be eliminated or at least put with some boundaries around it? What are the things you can take that make you feel better? And what is the role of hormone replacement therapy or hormone therapy in general, along with medications, pharmaceuticals, and supplements in breaking this loop? I want to give you kind of a linear plan to safety and to nervous system regulation. I think it's non-negotiable that you start with the gut. So do the gut work that we laid out. I think it's non-negotiable that you provide the body with fuel, especially if it's exhausted every single reserve it's got, to help it manage the cortisol loop. Again, to remind you, that was B, D, magnesium, omega-3 fats, amino acids, all the things, right? And then I think you move into looking critically at the things you can bring into your daily life. 10 minutes. What is 10 minutes going to look like for you a couple times a day? And then from there, you move into your lifestyle. What is present that is causing you chronic stress? And start to make some changes there. Your next step is to go into modality mode, where you are allowing others to help you teach your body to understand safety. That could look like acupuncture, massage, craniosacral therapy, energy work, any of the things, being out in nature. You pick, but something that allows the nervous system to feel safe. That to me is layer 1. And if you're ready to graduate to the next layer, then we start to look at hormones and where hormone therapy might play a role in this equation. We start to look more critically at inflammation, and do we need to target inflammation a little bit more? We look at the immune system and immune health. We look at what we can do for better cognitive health. But those are all layer 2. And remember, you shouldn't be going to layer 2 without walking through layer 1 first. So the cortisol loop is real. and it's present in all of us, and it's causing a slow, destructive decay of all aspects of our health at every level. I want us to turn that around, and it's fundamental to the holistic approach. It's a part of where maybe even personally I fail sometimes because I can get caught up in whatever's going on and forget my own advice. I'm just being honest with you guys. But I want us all to do better for ourselves and for our families and for our health and for being able to show up in the world the way we're supposed to. So it's time to get out of the cortisol loop. It's time to understand it, wrangle it, wrestle with it, acknowledge it as the elephant in the room, and build a healing plan that works. All right, I'm going to stop there because I could probably go on forever about this particular topic. But on this show, we tackle all aspects of this, right? But if we're trying to think holistically, we can't put anything together without thinking about this. All right, I hope you enjoyed this episode. We post new episodes every week. I'll see you guys next time. Before you go, remember, healing doesn't happen all at once. It happens in moments. If today's episode gave you one of those moments, subscribe and keep learning with me. The next video is right here, and it picks up right where this one left off.